Hi, good afternoon. Welcome to another episode of Yourself or You and Your Health with Dr. Love. I am Dr. Yusuf. Today we want to talk about something that a lot of people might not consider very serious, but it is very serious. And this is a disease that in the United States, about 8 million women are considered to visit a health facility every year. That is 8 million women visit a hospital for this reason. 20% of women would have acquired this disease at least once in their lifetime. That is huge. 8 million women getting this disease in a year. And this disease is what? Guess what? Urinary tract infection. I talked about it earlier. But today's discussion will center around personal hygiene, how we clean ourselves after using the washroom. Now, after using the washroom, there are about 3 or 4 businesses we do when we use the washroom. We do number 1, number 2, number 3, and some people say number 4. Number 1 is you peeing, number 2 is you pooping, and number 3 is when you take a bath. Using water is generally considered to be more hygienic and more effective in removing fecal matter and urine. There are numerous benefits. When you use water to clean, it leaves behind no residue and it makes you feel fresh after using and cleaner. When you look at the anatomy of the female genitalia, it has lips, the big lip and the small lip. These flaps are usually considered to keep urine after urinating. Now, it is inappropriate to put on your panties after urinating or use tissue paper to dab around or to reduce the load of urine around that area and put on your panties and walk on. It keeps it smelly with bad and odorous smell, and also with the bad smell, it is an indication of bacterial activities going on around there. So no matter how beautiful you may look in the outside, you are considered not cleaning the inside. And this is with due respect to every lady out there. Now, there's a very strong push and advocacy for using water to clean, irrespective of where you are, be it at home. A lot of people may want to take their shower after doing that business, number 1 or number 2. But what if you're not at home? You're at the office place, or you're at the mall, or you are in some supermarkets and you are pressed. You want to use number 1 or you want to do number 2. After doing number 1 and number 2, it is considered to also use water. It means that these facilities should be equipped with what something they call the bidet spray. A bidet spray is a hand device that sprays water in the genitalia and keeps it grippingly clean after using the washroom, after doing number 1 or number 2. And there was a study I think this is very interesting, a study that was done recently. 2 group of women, right? There's a study that shows the correlation between the use of water and UTI infection versus the use of tissue paper versus UTI infection. It shows that in this group of women, these 2 separate group of women, those women who used water to clean properly after using number one or doing number one or number two have less chances of UTI, urinary tract infection, than these other women that did not use water and would just use tissue paper and move on as if business as usual. So we are advocating for the use of water to clean yourself after doing number one and number two because it reduces the chance of getting UTI, and especially recurrent UTI.